to Dr.
Yes, yes. I'm Nadia. I'm the medical student.
Okay, so Nadia, it is very gainful that you came here with us, and I am going to discuss something with you. So, could you please, are you with some doctor or nurse?
Yeah, yeah. Just now I told you, doctor, I'm a medical student. I'm a third year medical student. I'm here for an for attachment.
Okay, so we are grateful that you are here for attachment, and I have known that you are doing a great job. You are doing great in your rotations. So, first of all, we
Thank,
are sorry.
thank you for appreciating me.
Yes, yes, doctor. Okay, so Nadia, could you please elaborate with what concerns you are facing in discussing with these constipation issues?
So actually, in the rounds today, I heard that one child was admitted with the severe constipation, and the doctors on duty, they were discussing between the differences or the possibility of functional and organic constipation. So really, I know what is constipation, but I don't have any idea what do they mean by functional and organic. So I was wondering if you could explain a bit more to me.
Okay, that's great. So first of all, as we start, do you want your colleagues to come and join with us because they will also get benefit from our discussion?
Yeah, yeah, some of my friends are here. Yeah, they're here now. You can start, doctor.
Okay, that would be great. So, Nadia, as in our basic knowledge and our basic medication, there are two causes of constipation now. One is the functional and the other is organic. In the functional constipation, you will find the dietary factors. Are you understanding me?
Mm-hmm.
So, what kind of dietary factors I am telling? Do you have any knowledge about which dietary factors will lead to functional constipation?
Yeah, yeah. Less intake of water and fiber can lead to constipation. That's what we know.
Okay, so this less intake of water and this decreased fiber intake, it will lead to functional constipation. In the functional constipation, what will happen is this, you are well aware of our gut system, no? Okay, so I am drawing here picture for you. Here is our gut system. Okay, so normally what happens in some children, the normally the food it goes through the gut system properly, but in some children the movement is slow. That's why the food is not moved throughout the gut, and it took a longer time to pass through the peg passages. So the food accumulates there, and also for a longer time the water from the food it will go pass out and the stool becomes harder. That's why they feel constipation. Constipation is there. Are you understanding me?
Yeah, yeah, doctor. That was a good explanation. Okay. But
Okay, and
is the difference between these two? This is
okay,
constipation, I understand.
okay. Now, and as you see, there is no any problem in the gut lining or in the gut passage. But if there is a problem in the gut passage, if there is a stenosis in the gut, if there the ganglions in the gut are affected, if there is a ganglionic gut, then this will lead to a problem. Are you
Oh,
understanding?
okay, okay,
So
okay.
there are anatomical factors which will lead to the constipation. These cases we will considering as the organic constipation, in which some reasons will be there. Either there will be any endocrine problem, like there is hypothyroidism, in which you get the constipation. Either there are some drugs which can cause the constipation. So these problems will be under the heading of organic constipation. Are you understanding?
Yeah, yeah, I got it. So you mean to say that in uh, organic constipation, we have certain identifiable causes of constipation, whereas in
Yes.
functional, uh, diet is the main reason. That's what you mean to say?
Yes, dietary factors are the main reasons, and apart from them, there are the lifestyle modifications, and also some factors related to the toilet training. Like in some babies, they are hurried, they are rushed in playing, so they do not properly poo. Are you
Mm-hmm.
understanding?
Yeah.
Doctor, you have 4
They do
minutes
not.
left now. 4 minutes, okay?
Okay. So these are the reasons. While there are some other reasons in functional constipation, which we have to take it seriously. So I am giving a message to you. If you feel any red flag signs, so what will be your red flag signs? If there is vomiting along with this constipation, if there is tummy pain there, abdominal pain is there, or if there is blood in the poo, then these are the red flag signs for which you have to seek the medical emergency treatment.
Okay,
Are
doctor.
you
Okay,
okay?
okay.
So, Rabia, do you understand? Nadia, do you understand what I have told you so far? So there are two causes. There is either functional constipation and the organic constipation. The difference is that of dietary factors, and in the organic is there will be an identifiable cause. Okay,
Mm-hmm.
so in we have to refer a patient present to us. We have to refer them to any dietitian for their proper caloric intake, for their proper diet schedule. And I will
Okay.
also guide you some new trusted websites, some written leaflets from where you get research and you also get benefit from these parts.
Mm-hmm. Okay.
Oh,
That would be great, doctor.
thank you. If you still have any other confusion, you can call us and you can communicate with me at any other time.
Sure, doctor. Thank you so much.
Thank you.
Okay, Dr. Priyanka, you attempted very well. You had
Thank
knowledge, and but the only problem that was there was that you spoke a lot, and the role player was not able to ask any questions. So the only question
Okay.
that the role player asked was the difference between the organic and chronic constipation. Maybe the role player had other questions. Okay.
Okay, madam.
So you actually, when you started off, instead of asking the student what questions she has or what is the agenda of the meeting, you directly started. So you wanted to ask something about constipation. Okay. So you have
Okay.
to allow the role player to tell you what is the concern, what is the issue. So you ask for the attender. You have to assess the knowledge. Okay. So for example, she said, "I know what is constipation." So you can ask, "Okay, so what else you know about constipation?" So that explanation of constipation that you told, rather the student could have told by himself. So you would have said, "I know
Okay.
that when the stool gut movement is slow, the stool stays for a long time, it becomes hard and dry and difficult to pass. So that's when
Okay.
constipation happens." So then you can, appreciate, yeah, so you have the basic knowledge. Then,
Okay.
so you can ask again. So have you ever heard about functional and organic constipation? So maybe she will say, no. You have any idea what it could be? So you have to, repeatedly probe, because this is a medical student or a nurse. They will have some baseline knowledge. So you have to assess the level of knowledge. So you started
Okay.
from the basic point, which maybe the person who is attending a meeting already knows. So maybe you wanted, the role player has other questions. Okay, so always P, now you remember PACER. P is prior
Yeah.
knowledge.
Okay,
Okay,
ma'am.
and any other
Yes.
person who wants to attend the meeting. So you asked for anyone else that who wants to attend the meeting, but then again, so what do you know about constipation? So do you have any idea what is organic constipation or what is functional constipation? Then if she says no, not at all, please tell me. Then you start off. Okay.
Okay, ma'am. First, we have to ask our prior knowledge. First, we have to repeatedly
That,
ask from them what is there,
yeah.
what they
So
know.
what do you think? What do you think it is? So okay, then you start, and then you drew the picture. That was good. Okay.
Yes.
We were checking concerns, but after long explanations, okay, with remember, don't speak longer than 30 seconds. Once you have explained a certain part, so you told that, this gut can have certain problems. So what problems you think this gut can have that can lead to constipation? Okay.
Okay.
Rather than you
Okay.
yourself going up and explaining everything, because this is a medical student, maybe he knows. So you have to,
Okay.
whenever the medical student is there, always ask for his ideas. So what do you think problems can be there in the gut that can lead to poor movement of the gut? What do you think? Then he might say there could be some nerve issues. Then you have to say, excellent, that is the Hirschsprung's disease, in which a
Okay.
segment of the bowel doesn't have the nerves. Don't say aganglionic directly, okay?
Okay. Okay.
Okay. So maybe if the student himself says the gut is aganglionic, then you can use the term, okay? So the
Okay.
gut, it's some parts of the gut, they lack the nerves, so the movement can be poor. Excellent. That is Hirschsprung's disease. Okay. Then you go
Okay.
ahead. What do you think? What else can be the problem in the gut? Then you will say maybe there's some functional, there's some anatomical obstruction like a stricture or something.
Okay.
And then when he runs off his out of his ideas, you are the one who's going to take it further. So there could be strictures, there could be any other problems in the nerve innervation, like spinal defects that can lead to these situations. Can you think of
Okay.
any spinal defects that can lead to constipation? Then he will say, yeah, maybe a spinal dysraphism can cause it. Then you have to appreciate, excellent, yes, you are on point. Okay.
Okay. Okay. Okay.
Okay, so you have to ask his ideas more rather than giving out all your knowledge. Okay, this has to be an interactive session. Okay, so that's very important. And then
Okay.
clearly at the outset, because your goal is to differentiate between organic and functional constipation. So basically, you will say that organic constipation has certain identifiable causes that are leading to constipation.
Okay.
Whereas functional constipation, there are no identifiable causes. Okay.
Okay.
No anatomical or other causes, okay, but certain causes like dietary factors and psychological stresses are
Yes.
involved in functional constipation. Then you take
Yes.
each of this. So then you can say, okay, first, what do you want to start with? Maybe we can start with functional constipation first. Then she says, okay, yeah, tell me about functional. Then you start with functional. Then once you're
Okay.
done with functional, okay, now if functional constipation is clear to you, shall we move on to the organic causes? Then again ask, what do you think? What do you think? What do you think? And then you had to discuss about overflow incontinence. So in functional, you can explain. So the child is holding the stool for a long time. Some of the water around the stool, it leaks out. Okay.
Hmm.
So
Hmm.
that is called overflow incontinence. Okay. So like this,
Okay.
so you had, certain terminologies like overflow, Hirschsprungs that needed clear explanations because that was the task that was given to us. Okay.
Yes.
So
Okay.
that those were the points that I would say. Empathy was there. You were appreciating his knowledge and his, uh, uh, urge to, learn more. So that was good. You repeated yourself. Instead of now you repeating yourself, you could have asked the medical student to repeat. Because when the medical student is there, it is better to ask him to repeat. Okay, but if the parents are there, it's better for you to repeat in some scenarios, but in some scenarios it is acceptable. So maybe you could have asked, so can you summarize what we discussed so far? I understand. And if he's still asking questions, you can say, I understand you're very keen to learn. You have a lot of questions in your mind. No worries. Let us first summarize what we did today, and maybe we can arrange another meeting for your further queries. Okay.
Okay.
And then you gave him some websites to read about constipation, okay? And then
Okay.
refer, maybe you can say, I can in referral, of course, you cannot refer him to a gastroenterologist, but you can say, soon we will be having a rotation with the in the gastro department, and I hope that you will see a lot of cases and you will, learn better about it.
Okay. So here I have to tell her that you will be rotated in some gastroenterologist
Yeah, for
department.
example, you have to refer. You can say if you're interested, I can I can, take you to the gastroenterology OPD, and there you can see a lot of these cases,
Okay.
and that will help you to, understand it better. Okay, so
Okay.
So you have to repeat, refer, reference. So you have to tailor slightly according to the situation, and but you
Okay.
have to fulfill all these requirements. Okay.
Okay, ma'am.
Okay. So that's
Okay,
how
ma'am.
it will work.
Just
Okay.
wanted you,
So
because you started good and you have a very good explanation about it. The only thing was it was long, 2, 3 sentences instead of short, brief sentences. The other thing is you have to give time. Once you are giving an explanation, wait, let the role player speak. Because when you said red flags, she didn't ask for the red flags actually. There was no question for the red flags. You yourself asked, okay, I will tell you about the red flags that is important. So this communication scenario, see, this communication is scenario you're being assessed on what? The way you are explaining the condition to the parents. It's not about your information or your knowledge. It is also about how we will, if some medical case comes, how easily and how efficiently we bring this information for the parents, right? Instead of being on that side, we will let them ask a lot of questions, because as Dr. Madhya said, she just asked one question, functional and organic. And the other things which are mentioned over here in the scenario mentioned, because these questions are with role player. Okay, you will not start answering this question from your own, like you read the scenario and you go inside and you start speaking. Okay, this is functional
Yeah.
organic constipation. This we means overflow. This by this we mean heat sprung. It means you prepared these answers outside the station, because inside the role player will ask you about it. Okay, what is overflow? And it happens frequently. Do you think it is part of this or is it something else? Okay, so then you have to answer. So communication is about, and you cannot ask them, you cannot tell them, do you understand? Communication is how you behave. So you will tell, am I clear? Okay, you got it?
Okay.
You cannot understand their thing, like whether they're understanding or not. It's wrong. You have to be clear, like you have to improve, you have to repeat, you have to draw, you have to check understanding. So you take it on your own part. Am I clear? My drawing is clear. Do you want me to repeat anything? Or if anything is unclear, I will be repeating it again. Okay, so don't say like that. Do you understand or not? Right? That was the thing. And the other thing
That
is, let the role player
I
ask. Sorry?
okay. Instead of that, I have to say, am I clear to you?
Yes, you
Yes.
have to ask like you have conveyed the information the right way. The basic purpose of this scenario is like whether you are avoiding jargons and the medical student is able to like get you, okay? In a similar,
Okay.
like he has medical knowledge, but definitely you will appreciate in between him also and ask him to ask more questions, and it's a discussion basically. So involve him also.
Oh, okay, ma'am.
but your knowledge was good, Priyanka. So you could have answered all the questions that the role player had. But you have to make sure you are giving time to him, because in the stress of the exam, generally,
Uh,
the candidates are speaking a lot because they want to, uh,
hmm,
knowledge. But as Dr. Shumalia said, this station is not about showing the knowledge. You need to have
hmm,
knowledge, but you have to answer coming at the
hmm,
level of the tender, and also you have to answer what questions they have rather than you putting up your you know
hmm,
questions to
hmm.
them. Okay, so just talk little, let them speak more. Okay, so that is the message for you. Okay, but otherwise it was very well taken up. The red flags
Yes.
were the questions that
Actually, this
I
was my
had.
first communication. Inshallah, I will do better next.
Yes, of course, inshallah. Okay, so now you know all the points, right?
You know, communication is very important, very easy to get your good score, because you know it's you have the scenario outside, and mashallah, everybody of you have a good knowledge about the diseases and all those. The only thing is the structure. So inshallah, try to get full marks in your communication just on the basis of this, that you have to be a listening ear. Okay, listening ear, and just when he is asking the question, do tell the relevant information. Okay, don't tell the information which you want to give because you think it's important. Okay, because this is disease is important, we have to give. No, just answer the role play question, and inshallah, because you know your marks counts in every station. So this is easier station. You have to score full marks in this.
Okay, ma'am.
Okay, good job, doctor.
Thank you, ma'am.
Just, I think we will record this session. Already the recording is in progress, and Dr. Kunan also, her internet issues resolved. So we will begin with the short clinical. Just if it ends, we will start with a short clinical next with Dr. Kunan.
Okay, doctor.
Okay, inshallah.